right. Hi, class. My name is Adati Tarfa, and we will be talking about qualitative research methodology in health services research. Okay, this is a two-part series, and I will go ahead and get started. So the first part, we will understand what is qualitative research, how do you design a qualitative research study, and then for the second part, it's how do you conduct actually a research study, and then how do you present a qualitative study. So for my introduction, I got my pharmacy degree at your university, Drake University in Iowa in 2017. I immediately started my master's program here at the University of Wisconsin-Madison and then ended that in 2020 and just started the PhD program in health services research in pharmacy. And so my research, so I am being trained as a qualitative and mixed methodology researcher, and I generally explore barriers to care and medication adherence in potentially vulnerable populations or historically marginalized populations living with chronic diseases, so diabetes and or HIV. And so for my independent research, I engage key stakeholder perspectives, so perspectives of pharmacists, social workers, and people living with HIV to provide insight into how pharmacists can improve the care of people living with HIV. So I really get to incorporate my pharmacy degree into my research. And I just have a picture of me at Drake University in 2015. I did a research about the Ebola virus disease. So when I was in pharmacy school, and this is Dr. Chuz and I at my graduation. So it's really an honor for me to be here with you. And this is a 25-minute video. I hope I'm able to do this. My first take was 40 minutes. So let's see how I do. And our learning objective by the end of this video, I hope we'll be able to just generally describe what qualitative research is, differentiate between qualitative and quantitative research, select the appropriate qualitative research approach for a research question, and then be able to recognize the problems qualitative research can answer in your field. So I know that we have a very rich class of pre-professional professional students, and so I'm really excited to see how you can apply this to your area of interest. And so what is qualitative research? So it's a method of inquiry that really uses open-ended questions to gain deeper insight into things. And so qualitative research is used to generate ideas or just get an understanding of an issue. And so as a qualitative researcher, you're also going through a training procedure. So you develop the research question, you find out what needs to be answered, who needs to answer it, and then you use a lot of your maybe past experiences or personal reflections or past research to draw meaning into what you gain from your informants. So from people you interview and ask questions, and then you as the researcher, write the final report and present that information. And that's what our second presentation will be about. And so I don't really want to delve into differences between qualitative and quantitative, but generally quantitative research is really rich in numbers. It incorporates larger sample sizes, and data is analyzed using a lot of mathematical statistical tools. And it's used usually to confirm a hypothesis, to draw connections. So X causes Y to happen and so on. And then it's usually close-ended. While qualitative research, we're doing something a little different. It's smaller sample size. Data is interpreted more subjectively. We're more exploring ideas. It's open-ended. We're not really trying to ascertain some correlation or so on. We're not trying to say X causes Y. We might try to understand why does that happen? How does that happen? What is going on? All right, so there are so many different types of qualitative research. And so I selected this based on the ones that wowed me when I first learned about qualitative research, as well as what was in your textbooks. And I know that your next class, you'll be talking about community-based participatory research. And then mixed methods, it's a combination of quantitative and qualitative. And so these next slides are going to just I'll briefly talk about these kinds of research and show you some papers that I hope you'll be able to explore in your own time, all right? So for discourse analysis really is the study of language, written or text and communication in relation to its social context. So someone can do a discourse analysis of how I'm talking and really try to interpret the meaning behind my words. And we see it used a lot in political science studies. What are they really implying? What is this person implying when they say this and so on? And so an example of discourse analysis And I carefully selected the examples that I'll be showing us. So related to our field, there might be pharmacy because I'm a little biased, but I did try to find occupational therapy and some nursing as well. And so this study says, I haven't even phoned my doctor yet. The advice given role of the pharmacist during consultation for medication review with patients age 80 or more, a qualitative discourse analysis. And so this researcher observed communications between pharmacists and patients that are older than 80 years old when the pharmacist was trying to perhaps give them some consultation. And so they found out that perhaps older people were saying, we haven't really communicated with our doctor and so on. I'll let you, read Dr. Salter's work. And then conversation analysis. So my mentor does a lot of conversation analysis. It's similar to discourse analysis, but in conversation, it's really a study of social interaction and the talk in interaction. So it really involves detailed examination of the interactions, how words are, uttered and so on. For example, the pauses that I'm doing, when I'm saying the next word, the and all of that. So conversation analysis does some of that. And so in Dr. Papanic's study, she explored nurse-family communication during and after family meeting, and she found out how nurses maybe contribute to a conversation. So she found out that nurses were more likely to complete physician sentences or really conversed when they were asked directly to intervene. And so they weren't just kind of interjecting. And then grounded theory. So this study is used to construct the theory or hypothesis from data. So it's based use on information when there's little information about a subject. So you're grounded really a theory. And so exploiting the potential for occupational therapy was a study that I selected for us to go over when we have the time. And so this was from 2003. We were still trying to understand the occupational therapy field. And so grounded theory is used for research as such. And then content analysis, I'm geeking out. This is my favorite. And content analysis, there are so many different types of content analysis, but it's simply used to determine the presence of certain words, themes, or concepts within a given qualitative data. And so it's kind of aggregation, and sometimes content analysis can actually be quantitative. So if I start counting words, so content analysis, for example, in my study, I select themes. So I'm trying to understand what are barriers to care for people living with HIV. And so when people start saying homelessness, then I come together, bring together the quotations where they said homelessness and kind of put it as, okay, so this is one theme. And so I'm, putting together those. And so I could turn my study into counting how many times homelessness was mentioned. But in my study, I'm just trying to get a general idea. And so I had Dr. Young's paper. So this is a co-collaborator, colleague of mine. It's a study about why am I not taking my medications, barriers and facilitators of diabetes medication adherence across different health literacy levels. And so also understanding those barriers to care for people in different health literacy levels. And then thematic analysis is really similar to content analysis, but the difference is while content analysis has different ways to do it and theories that kind of drive it. And so content analysis can be directed by a certain study. So I can look at a study that looks at social determinants of health. So I can list several social determinants of health and see what my informants say about barriers to care and see which social determinants of health they fall under. So content analysis can be more directed. While thematic analysis, we see it similarly to content analysis, we are aggregating different themes. This is more generally used. So this is used sometimes when you don't have a theory backing up your interview questions and data analysis and so on. And it involves really going in depth through the data set and identifying, you're seeing more patterns in things. And while for content analysis, smaller that you're looking at themes, thematic analysis gives us a general more pattern to things, okay? So a study example I have for us is actually a paper of Dr. Cho's with her advisor, Dr. Shuma. So it's a thematic analysis of how patients, prescribers, experts, and patient advocates view prescription choice process. All right, phenomenology is also one of my favorites. So phenomenology is really a study of phenomena, and so appearance of things or how people experience things or the way we experience things and the way we derive meaning from our experiences. And so we see this, for example, this study looks at the experience of antiretroviral therapy, so HIV medication for Black West African women who are HIV positive and living in London. And so this is trying to see in depth, what are the experience of this pre-selected group? And it's going to be very different from people, Black women living with HIV in New York. And so this is what phenomenology is. You're thinking of a phenomenon, something that it's an outstanding personalized experience, or really for a select group. And that's when you use phenomenology. Then ethnography, really, I personally see it as related to phenomenology, but ethnography, it's more so how you collect the data, is you immerse yourself. So ethnography is usually used in anthropology research, where we see people would actually live with people for 10 months. So for example, if I wanted to study the previous study that we talked about of Black women living with HIV in London, sometimes ethnography, I wouldn't say it goes as extreme as that, but I could actually pose as someone living with HIV in that community and kind of assimilate into it to really understand their culture. But there's some ethical considerations, of course, to studies like this. And, but however, this is what ethnography is. You're really, you're studying a particular social group or cultural group with an aim to really understand it, but you're immersing yourself into it. And so Costello did a study of nursing for older dying patients, and that's another one that's related to health sciences field that I hope we can take a look at. All right, community-based participatory research. This is an amazing form of research that's really advocated for right now, because it's when academic researchers are doing a lot of research on different groups, but instead of we coming with our own preconceived notion, we actually have the community members inform our own research. So they're part of the group. They're helping us learn. We're learning from them. They're informing the research. They're not just study subjects. And so an example is actually a paper that I wrote with my advisor. It's a preliminary engagement. So we had a patient advisory board of African Americans living with type 2 diabetes that helped us design our study for African Americans living with type 2 diabetes. So you have people with lived experience really helping you see what you can't see and being part of the research process. And we have fantastic results because of this, that this community members are part of our research team, and we're not just researchers researching on a group. All right, so mixed methodology, mixed method study is the combination of qualitative and quantitative. And one way mixed method really stands out a little bit more is there's so much rationale. So this diagram on the left is, I saw that in mixed methods paper, and it's really showing, what quantitative data was used, why was it used, and then what qualitative. So it's not simply just collecting quantitative and qualitative data. There's an in-depth approach to really understanding the rationale, seeing what kind of data was used, why, and so on. And so there is a mixed method study that I have over there that helps understand the facilitators and barriers to nurses' perception in continuing education programs. And this was a mixed explanatory study. And then that's when you use one information to actually explain what we see that's going on. All right. And then evaluating the validity and rigor of qualitative study. And so I would hope that we can get the chance to really go in depth into this table. When I did my first video, that was 40 minutes or more. I spent a lot of time on this. This is from your class, from the chapter 8, but I added the last column there to really show you, so how do we show that a qualitative study was rigorous, that it's a valid study, because there's so much subjectivity in it. So for transferability, we want to make sure that, there's an established relationship from what we looked at with the outside world. And so we try to use several recruitment strategies to make sure we're recruiting a really good sample of people. So a general sample that's slightly representative. We can't really do an entire representation based on a small sample, but that's what we try. And we know a lot about internal validity in quantitative research. In qualitative research, we really try to gain that through prolonged engagement with the research area. So with the research team, I know for me, when I was doing my master's thesis, I spent a lot of time engaging. So this is not ethnography. I was just at a lot of HIV meetings. So just understanding the community, the HIV community that I was part of in research. And I was also, so to make sure that my data is trustworthy, that I'm really telling this story, okay, that I'm presenting a true and accurate information. And then for reliability, that's like dependability, the level of confidence in our studies data collection, and then conformability. I have a different definition there than your textbook. You can please check with Dr. Chills, maybe argue with her a little bit to see if there's really a difference between what I am saying here and what the textbook says, but it's the extent to which study findings of participants' responses are not the researcher's viewpoint. And so to do that, to make sure that I'm not the study that I present as a qualitative finding, it's not just my own information. I provide rich quotes from this is exactly what participant A said. And so you see a lot of qualitative research is really presented at what this person said and that. And then I also show how I came to that conclusion, how that data, how I analyzed the data, what theory was informing what qualitative approach that I used. Okay? And then for that dependability, going back to it, for qualitative research, we have a detailed audit trail of de-identified information that really shows the study procedure, how, what questions are, interview guides, and so on, our recruitment documents, they're all available for edit so that you our viewers that are trying to see is the study valid or rigorous, that there is some level of confidence to that. All right, so advantages of qualitative research. I am a huge proponent of qualitative research, as I mean, you might be able to tell from this short presentation, but it's really flexible. It's of course in the natural data set, natural setting, for example, ethnography, where we're studying, really immersing ourselves, and then it's meaningful and, it provides meaningful insights. And sometimes when, for example, when I was studying my HIV, people, barriers to care for people living with HIV, you can start finding out that perhaps homelessness keeps occurring. And then I go, I haven't thought much about homelessness. So in that flexibility, I can start really directing my study to look a little bit more at homelessness. So I have the flexibility to do that, and I'm gaining meaningful impact. And this last thing, empowerment, is really my own personal touch to what qualitative research. So for example, because I research with vulnerable populations or potentially vulnerable populations, their stories are really important. So I'm not just saying, well, people living with HIV are not taking medications, or people that are that have substance use disorder and living with HIV are not taking their medications. And I'm not just giving numbers as 20% of them. Qualitative research gives a chance to share their insight, their story. So, medication adherence, not taking medication does not happen in a vacuum. And so we get to hear the stories behind this and the reason. And, sometimes it produces empathy, but also actionable items. So from that, we can, derive policies to help with that and so on. And so there's this empowerment that they're getting to share their voice, they're getting to advocate for themselves by sharing their own personal experiences. And then the disadvantage, really, subjectivity. It's partly the rich part of qualitative research, but also the reason why qualitative research, people question the validity, because it's usually my interpretation of a data, my interpretation of an interview is going to be different from yours. And that's okay. So in qualitative research, it allows for that, but sometimes we want to see uniformity, in what we're finding, especially within a research team. So limited generalizability, again, we can't really transfer that information. We can't say, well, this is the reason why people living with HIV don't take their medication, because I interviewed 5 people in Wisconsin. I can't generalize that to the United States. And then qualitative research is really labor intensive. So you're interviewing people maybe for an hour, so 15 hours if you're interviewing 15 people. So you're transcribing that data, and so you have hundreds of pages of information. And so data management is hard, and then the data analysis process too is a lot of work. And so there's a lot, it's really intensive, but very fruitful, of course, I would add that. And then, so how do you design a research study? So for at least the next maybe 5-10 minutes that I have, I would go over this. So where do I get a research idea? And so your research idea can be derived really from your experiences of loved ones. I had someone in my program take care of their parents during an illness. And so they were able to draw from their experience to design their dissertation topic. And so you can make observations from work in the pharmacy, in the hospital and so on, and see, what are some gaps that you're beginning to observe. And then there are trends in the field. For example, a lot of people are utilizing, for example, when pharmacists want to provide a status, there was a lot of research that went into pharmacy reimbursement models. And then classes, companies, and other presentations. So you have an idea, now what? Well, you can review what the literature has done already. I would recommend paying attention to this discussion section, because in the discussion, you're discussing what has been done. You know, this is my finding, this is how my finding relates to other people's finding, and this is what else needs to be done. So that's like your cheat sheet there. All right, so consider if your idea is feasible. Is this achievable? Can I study, maybe, let me think of something really big, but can I study why Americans are not, you know, getting vaccinated during COVID? So that's like a really large subject, or something like that. I think that's a bit feasible, but you get what I'm saying. Do I have the time and the resources and so on? How can I do this in, you know, with what I have? So, and then, so you have your idea, you kind of know how you want to narrow down your idea, and then how do you proceed with your ideas? I highly recommend sharing with others, openly discuss it with your peers and colleagues, and you can write a specific aim. So you start to fine tune that idea on paper. The specific aims is a 1 to 2 page document that identifies what the problem is and how you plan on answering that problem. And so you're starting to formulate what you're going to do. And then lastly, you know, you definitely need support. You need approval. So from the institutional review board, approval from your institution to conduct that research. So you do that by really writing a proposal that details, this is what I'm going to do. Is it ethical? Is it feasible? And so on. What's the best way to do it? And you can also apply to grants. And so university grants, their local organizational grants, or the National Institute of Health provides a lot of like big grants to big institutions. And so having that proposal is sort of like your next step. And so that's really what I have about just your general spew of how do I even think about conducting research. I thought it would just be like a switch conclusion to learning about really fast about what qualitative research is and so on. And so the next slide is really just we're reviewing what I said we would do. So we've talked about what qualitative research is. We have a general idea. We have a general idea of the designs and the different approaches. And then so next, we'll talk about how do you conduct a qualitative research and how do you present a qualitative study? So presented in conferences or in paper format. All right, so here are my references. Any questions you have, please direct it to my email. I do have a Slides active Twitter account, so you can check that out too. And then you can look at the research group where I'm being trained at the University of Wisconsin-Madison. And yeah, so thank you so much for listening. All right.